Hello, everybody. Can't believe you all came out in the cold. Thank you. Thank you. At least the roads were easy to maneuver, yes? I'm Amy Waters, director. I hope most of you know me. Welcome to the Worcester Senior Center, where older adults participate to help take charge of your health. Today, we are fortunate to have as guests leaders from the Institute of Healthcare Improvement, where they work to improve health and healthcare worldwide so that everyone has the best care and health possible. We will be learning about age-friendly health systems from Alice Bonner, former State Secretary of Elder Affairs and now Senior Advisor for Aging, along with Kellyanne Johnson, Senior Director at the Institute for Healthcare Improvement. Let's have a round of applause for our distinguished speakers.
Thank you, thank you, thank you. We're so excited to be out of our office today. This is like a field trip for us.
Truly, though.
Kellyanne and I are really glad to be here. I haven't been in this particular building since, I was with Elder Affairs back in, until 2019. So we had many lovely events here, and it's wonderful to be back. So thanks, everybody, for braving the elements and coming out today. So we are going to talk about two things today, two broad categories, and we want this to be interactive. Kellyanne and I were originally saying, we don't really need any slides, and then we thought to ourselves, yeah, we probably can benefit from some slides. So we do have some, but part of the reason is we want to get you all to be thinking about these topics and to be sharing your ideas with us, because that's how age-friendly has gone from 5 hospital systems around the country to over 4,000 systems now. And you're going to hear a lot more about that from me and also from Kellyanne. So here's a question to get us started, which is, can you share something that has happened to you, something you've done in your life that you're most proud of? Something you're proud of, anything. And you can just shout it out, and I'll repeat it so everybody can hear. Volunteering, love it. Whole table of volunteers. What else? Rescuing dogs. Great, so important now when we're hearing about the fires in LA and all sorts of other things. Yes, donating. Donating what? Your time or? Yes, ma'am. Defending the education of our students. Great one. We need that for sure. Married to a good wife. Okay. Clearly we have a great group here, and keep those ideas coming, because this was just to get us all started. So again, the personal stories are important, right? So this is a picture of my mother in the blue sweater, and she lived in Western Massachusetts in memory care. And one day, she was insisting on baking cookies for everybody, all the people in the memory care. And, she had Alzheimer's disease, so she had trouble. She couldn't use the kitchen by herself. And it was lunchtime, so all the staff were busy, and nobody could help her. And this is Beth Vittori. She was the director of the entire campus. And when she walked through and heard the staff and my mother getting more and more upset, she stopped what she was doing and she baked cookies with my mother. And that's an example, right, of leadership, but it's also bringing humanity back to what we all do and what we can do together. So what Kellyanne and I are talking about today with all of you is what we can do together. And the good news is, you'll hear us say this at the end also, you're already doing a lot of this here in Worcester, the city and the county. So when we think about, how we work together, there are core values. Everybody has their own core values, right? We wouldn't say these 4 things are what everyone has to say are their core values, but these are values: respect and inclusivity, teamwork and trust. Those are things that can be part of and can help to form a community which is a group of people who come together and maybe have very different ideas about things and don't always agree, but can come together and find a path and can say, you know, we're going to get some things done together. So a lot of us have had either jobs, volunteer jobs, paid jobs, or things in our families maybe too, where we've walked in and we've said, you know, the way this is working is not working. You know, the way things are is not okay. I've certainly walked into jobs like that over my 40 years of working. And the question is, how do we have the courage to go into a new place where nobody knows us, nobody knows our skills, nobody knows what we care about and our values, and to say, you know, maybe there's a different way of doing things, or why do we do it this way? Maybe there's a different idea, a different approach. So just asking those questions, putting those questions out there, getting that discussion going. What about homelessness? And what about homelessness that's growing right now in the U.S. with older people? This is a much bigger problem than it's ever been before. I live in Boston most of the time, and you know, I go running sometimes in the morning, and there's a lot of people living on the street, living outside without a roof over their heads. Can you imagine last night? And it's happening every day. So again, this is something where it's a public health issue, and that means it's, for all of us, it's our issue, right? And it's about social justice. We can't just walk by people who don't have a roof over their head and think somebody else is going to take care of that. Turns out homelessness is an issue that sometimes falls through the cracks between the Department of Health, the Department of Aging, Department of Housing, all of those things. So we can make a difference, and a lot of people are working on this now, which is the good news. We're trying to, you know, improve that. So, next question. What matters to you? So, what's something that you feel is very important in your experience in healthcare? When you go to your doctor, nurse practitioner.
I'll run it. We can hear.
Yes, I see you getting in position, Kellyanne. Kellyanne and I both wore our sneakers today. In healthcare, when you go to a doctor's appointment, when you go to therapy, when you go to the pharmacy, any of those things or something else, what is important to you? What do you care about? That they're listening to you. Great answer.
That they listen explicitly and do not react.
That they listen explicitly.
And that my doctor knows that my ailments are not all related to diabetes.
That they're listening and you're telling them about what's really relevant and important to you, and not that everything is related to a disease or a particular disease. Somebody else. Respect. You want to be respected when you're there. You want someone to take seriously whatever it is you say. Okay.
Yeah, that they can refer you to the right people that can help you in case they can't.
Right. Knowing what they can do for you and what they need to refer you for. That's a great point.
And on the same lines, also just follow through, that they are going to do what they say they're going to do.
That they're going to follow through. So if you have lab work done, do you always hear back about the results, or do you have to call the office to get the results? Either way, you want to be able to communicate with somebody who can answer those questions. Anybody else? Yes, ma'am.
That there's continuity of care, that the person that I see today, I'll be able to see in a week or a month from now.
Continuity of care, very well said, and so important. We have something that we within IHI and throughout the healthcare system, and you have a lot of healthcare providers here in the room today also, we call it care transitions. That means, you know, maybe you're at home and then you wind up in the hospital for something, and then maybe you go to a skilled nursing and rehab for a couple of weeks to get a little stronger, get some therapy, and then maybe you go back home, or maybe you move to an assisted living residence or somewhere else. There's a lot of options out there. But each time maybe you're changing the people who are caring for you, the doctors, the nurses, the social workers. So that matters, that they're talking to one another and that they're speaking the same language, that they can understand one another and share information. That's something we hear a lot from people who are getting their health care in the system. So, all right. Keep thinking about this, because we're gonna keep asking about, what's important to you in the episode of care. So here's one thing that we learned about in the last couple of years working on age-friendly healthcare, and this is something called daily huddles. You can call it something else. You could call it, the team's stand-up meeting or whatever, but it basically means that every morning or every day, could be in the evening, could be at night, that, there's a meeting of all the people who are working with older adults or patients or residents, and they're talking about the cases in real time, like what happened yesterday, what happened on the previous shift, and things like that. And the older person is part of that. Not only are they part of it, but they're central. They're directing the conversation so that the whole team is standing there together, and the older person is right there in the mix, saying what matters to you, what's important to you, and communicating to the team, not through someone else, but with your own voice. And the picture here is to remind all of us that it's the folks who are what we call direct caregivers who are so important. In nursing homes, where I've worked a lot, they're called nursing assistants. In the hospital, they might be called medical assistants. At home, they might be called personal care attendants or assistants. In any case, these are people who, they might not have a license, but they're certified to do the job that they have to do. So when you do daily huddles, you're out on the units in the hospitals or nursing homes or assisted living, or even a home care team could be in someone's home talking together. So just something to keep in mind, and we wrote a paper about it so other organizations can do it too, and it's something that's spread quite a bit among a lot of organizations in the country. So, do you think I own a pair of shoes like that? I do not, is the answer. And in my humble opinion, no one should. Apologies if you're wearing those shoes right now. But the point is, you need to be nimble, and you need to be out there walking around seeing what happens. We have a project up in the state of Michigan right now with 4 nursing homes. And I went up there and we had a tour, and the administrator in one of the nursing homes, she's the top person, runs the whole place. We took a tour with her, and she would stop along the way when she saw something that was out of place. She would say, well, this IV pole doesn't belong here, and she'd move it. And then she'd talk to people along the way. She called every person by their first name. She knew every name of every person in the whole operation. That's showing leadership. And so, again, you got to be out there. You got to be talking with the team. So what is this picture showing you? Who are these people in this photo? What? Seniors. Who else is in this picture? Waitresses. Waitresses. And that lady's still working. She's a senior and she's a waitress, right? So, and she's listening. Love it. So these people in the old days, whatever you call the old days, we all might pick a different time, but these were the people who stopped what they were doing. They came by, they refilled your coffee, they talked to you, and they gave information when they had it, right, about the city or the town. Somebody'd be saying, oh, my partner's, sick or something like that, and they'd get into a conversation and they'd say, have you talked to the, area agency on aging or the ASAP, which we have in Massachusetts, or have you reached out to someone who could really help you talk about finances and things like that? It was a value that people had in their communities, and anybody could do this. This is an example of servers or waitresses, but people librarians did this. They still do. Libraries are critical. But now when you go and you have lunch, or when I have lunch by myself, this is what I see, is people, they're on their laptops, they're on their phones. Sometimes I'm on my laptop. It's a bad habit. But it's not the same, I would suggest. And so it matters that there are people in communities, and again, you probably know, but Worcester is an age-friendly community, and that means a lot of people in the city of Worcester for years have been putting together in 8 different domains, working with AARP and other organizations. They've been putting together what it takes to be an age-friendly city and what you can still do to continue to make it even better. So again, just to be thinking about, you know, who's doing that now. So, you know, one of the things about age-friendly communities and age-friendly healthcare is actually having mentors. And I put this slide in because, as Amy said, you know, when I was applying for the job of the Division of Aging here in Massachusetts, I had to meet with Governor Charlie Baker. I'd never met with Governor Baker, didn't know anything about him. For those of you who remember, he's like 6'6" and super scary until you know him, and then he's a wonderful person. But anyway, so I went in to meet him, and I had prepared like all these documents. I read all these regulations, and I was just terrified he was going to ask me something I wouldn't know. The only question he asked me in the interview, he said, "Have you read Being Mortal?" And by some stroke of luck, I had literally finished the book 2 weeks before. And so I remember, and so for those of you who haven't read this book, it's a really wonderful book. And Atul Gawande is also a great person. And it's about, you know, getting older. It's about making decisions at any point in our lives, but particularly when we get older. And working with, you know, all of us, our families, and the health system. And again, I show this picture because mentors and being mentored and being a mentor to someone else, all of those things are really an important part of age-friendly communities and age-friendly healthcare. And the good news is you don't need to be a world-famous, you know, world-class surgeon like Dr. Gawande. It's about each person, every one of us, making, you know, the commitment and making the effort that we can to move age-friendly practices forward and to be part of the healthcare system. So again, when we had that earlier question and we said, you know, what's important to you when you go and you talk with your doctor, nurse practitioner, dentist, whomever, you know, you heard some responses from the audience, but it matters that you speak up and say, I deserve this. I deserve age-friendly care. I deserve the care that I need and that I want, and continue to have that conversation. So I was somebody who needed health care. Back in 2019, as I've said, I like to run, and so I was running on the streets of Boston, and a guy on a bicycle just crashed into me, and I didn't see him. So he knocked me over, and I hit my head on the concrete, and so I was in the hospital, in the ICU for 9 days, and then I was in rehab and all this stuff. And they told my husband that I might need to live in a nursing home because I was so limited in what I could do. I couldn't talk like this, like I couldn't, no. Anyway, I was so fortunate that I had great care. And this is a picture of me with my grandson, Calvin, because after 2 years, I was better enough, and I got to throw out the first pitch at a Woo Sox game right here in Wormtown. And I got it over the plate, if you can believe it. I did. Anyway, my point here is I never thought I would get to this point. And so, you know, expectations really matter. People, you know, give you these expectations, but sometimes you just got to say, forget it. I'm not going with that. I'm forging my own path. I'm gonna get to where I want to be. And again, the other thing is, I will say I am only here because I got wonderful care in lots of different settings from lots of wonderful people. And so, you know, that kind of thing really matters. And again, I had very, very kind providers and caregivers. So again, you know, providing care to anyone is a matter of who that person is and what their cultural background is and all of those things. I know we have our colleague from the Alzheimer's Association here. This was a very nice article in the New York Times a couple of years ago. And, you know, this is a woman and her daughter, and the daughter got into the bath with the woman because that was the only way she could convince her to, you know, engage in bathing. And that's not uncommon in people who have different kinds of, dementia or challenges with their thinking. So this is an example of showing compassion at a really high level that, whatever it takes, and the dedication is there. And the other thing is it depends on your cultural background, right? Because, compassion doesn't look exactly the same to each of us. I know you have a regular lunch today and you have a different lunch from a different culture. And that's an example of inclusivity and working across different cultures. So compassion really does matter. So with that as background, Kellyanne is going to take us through age-friendly health systems and some of the IHI work that we've been doing.
Thank you, Alice. Round of applause for Alice. Thank you. And we'll be more from Alice in a moment. I just want to take a few minutes to share a little bit about what the age-friendly health systems movement is, what age-friendly care is, and how we are working with health systems around the country to improve care for older adults. And then we'll talk a little bit more with you about how you might want to shape that work that we're doing. So healthcare faces some challenges when it comes to the care of older adults. One is that this wonderful thing has happened over the past century, and longevity has increased. That's amazing, right? People are living longer, fuller lives. The healthcare system needs to get prepared for that, and they're not yet, and that's part of what we are working to address. The other challenge in healthcare is that there can sometimes be a lag between when we know that certain practices can improve care and when those practices are rolled out so that every person can equitably benefit from them. There's a huge gap. And part of the work of the organization that I work for, the Institute for Healthcare Improvement, is to work with health systems to bridge that gap. So the gap between what we know older adults care should look like from the evidence and what actually happens in practice. So we are closing that gap. And our this national movement is a campaign of multiple organizations, including IHI and the Johnny Hertford Foundation, and it is our mission to ensure that all older adults receive care that is evidence-based, which means it includes all of the components that are most important taking care of older adults. And importantly, that care is based on what matters to every individual. And you can't provide care that's based on what matters unless you are deeply listening to each older adult and waiting, understanding what that is, and then navigating forward different decisions around their physical, mental health, and the rest of your care. So age-friendly care, as we've come to understand it with older adults and clinicians that we work with, consists of 4 domains. What matters, which again is asking first and foremost older adults in your care, what matters to you? Who matters to you? What does a good day look like for you? And how can we make decisions about your care with you in the co-pilot seat that ensures that it aligns with those values, with the way that you want to spend your time? Medication. There's the case that some medications are harmful to people who are older adults, and health systems need to do a better job of knowing what those are and working with you to make sure you're prescribed the appropriate amount of those medications and that it doesn't interfere with what matters to you. So again, we can't make any of these decisions about medication without having conversations about what matters. The other components are mentation, which is making sure that everyone is set up to have their mental health cared for too, that you're having conversations about depression, dementia, delirium, and that is happening across care settings. Mobility is about, I don't know if you've heard about the movement in healthcare around preventing falls within health systems. That's been something happening over the past couple decades. We want to move the conversation to not be about just avoiding falls, but helping people remain active and moving in a way that's safe and adds value to their lives. Is there anything, Alice, you would add or clarify about the 4 M's?
I would just say, so spoiler alert, but maybe it makes sense to talk about this now. So in a few more slides, you're going to see this is called My Health Checklist. And don't get up now, but when you do get up, in the back of the room, there's a table, and we have about 70 of these in English and about 30 in Spanish. This is a guide for any of us who go through the healthcare system. It tells you some of the questions to ask when you're talking to the doctor, the nurse practitioner, pharmacist, dentist, podiatrist, whomever. And it just brings together all 4 of the 4 M's, so that, again, each time in your mind, you'll be thinking to yourself, first, what matters to me? How can I explain that to this person? With my medications, do I want to come off of some of them? Are there some I think might be missing I want to ask about? Do I have depression? Do I have some memory challenges? Do I sometimes get a little confused or whatever, and I want to talk about that? And then mobility, as Kellyanne said, are you as active as you once were and as much as you want to be? So My Health Checklist, if you want it, we also have it electronically online, but this is the kind of guide that can help to integrate age-friendly care, because it comes from us, older people. It comes from us asking the questions.
Yeah, thank you, Alice. And those are available in the back in English and Spanish, I think you noted. And the thing to think about is that we all deserve care that is appropriate for us as we age. And so we all have a role, either as older adults or caregivers to older adults, to demand age-friendly care. So this is a great tool to reflect on what that care should look like and some of the questions you might want to ask. I'll share a story from our colleague, Camille, who was recently in the hospital with her father, and she wrote the 4 M's on the whiteboard, and with every provider that came in, she said, in this room, my father is receiving 4 M's care that is going to be focused on what matters to him, and that's non-negotiable. And here's the My Health Checklist that will help us have a conversation around that. So across each of those 4 M's, what we work with the health system to do is to be ready to provide that care, that level of care. And that includes 2 major components. One is they have to know what is happening across each of those domains. They have to have a conversation, and not one conversation, but an ongoing conversation over the years about what matters to you, because guess what? That might change over time. An evolving conversation. They have to be assessing your mobility, assessing different components of the mind, and looking at medication. And then once they have that information, they have to do something with it, right? They have to act on the information that they've learned about the 4 M's. And so we work with nursing homes, with ambulatory practices, your primary care physician, with hospitals, to say, what will that look like in your setting? So who will ask the what matters conversations? Where will you be documenting what you learn? And how will you make sure that people are referred appropriately, as somebody said earlier, if that's what's identified? And how will you ensure that you follow up on that referral and support the continuum of care? From our work to date, we've engaged 4,000 care locations, so hospitals, nursing homes, primary care practices, and convenient care clinics like your CVS Minute Clinic in the work. And we know from data that they've shared that at least 4.6 million older adults have received care that included all 4 M's. That's wonderful to celebrate, and it's not enough. There are way more older adults in the United States, and so we have a lot of work to do to ensure that hospitals really understand what good care for the older adults looks like and put that into practice. And we talked a bit about the My Health Checklist. So if you have any questions about that, please talk to Alice and I, and please use that resource for yourself. It's also online, so you can download it later and use it electronically.
And that's what Kellyanne and I feel like every day. We can barely keep up. But, you know, it's a little bit of a joke slide, but the truth is we work with we've got people here from the UMass system. There's, people across town at St. Vincent's and Reliant, and you go to these healthcare settings. People are feeling very stressed. The healthcare system is stressed right now. There's a shortage of nurses. There's a shortage of geriatricians or doctors who work with older people and other roles that are really essential. So we know this, and for us, we want to acknowledge that when we talk to people. We want to say we know things are really hard right now. We know there's a lot of stress. We know there's staffing challenges. But let's talk together about what we can do together, because this is about focusing on what's possible and not saying, well, we have to fix everything all at once. Like, that's not going to get us anywhere. We have to say, what are the things that we could focus on now and improve? So, what is the one thing that you would say we should do if you're giving a recommendation or an idea to me and Kellyanne and our team of over 10 people? Yes, sir.
Getting my mobility in today.
Because of the virus that went around and changed social settings quite a bit, put a lot of stress on the system, and it's never really recovered. So I think there should be federal money coming to help deal with putting these healthcare facilities back in shape from what they went through.
Very, very important point. Thank you for mentioning that. So, COVID-19, the pandemic we had for several years, there was some, limited, but there was some federal dollars that came to states called ARPA money. So it was American Rescue Plan Act money. And when that money came through, it was able to be used to do some of what you're talking about. Certainly do some education and training and things like that. But what you also said is important, which is that money is pretty much gone now. And so you're advocating for more federal dollars. I think there's a lot of value in that for sure. What else? Yes, ma'am.
It's not only from the COVID, but it's also from the insurance companies. They're telling the doctors what to do and how long it has to take. Doctors have more paperwork to do than what they did even 2 years ago, and every time they turn around, there's more paperwork from the insurance companies.
So we have a new day and a new time that you're talking about, which is the relationships between people who pay for health care, insurance companies, health plans, and providers like myself. I'm a nurse practitioner, so I worked as a primary care provider for a long time. So those relationships are changing, and in some cases, payers and providers are coming together and getting funded to deliver care with the idea that there would be less paperwork, less bureaucracy, and improved ways to deliver more higher quality care. That's a tall order, and I think we're still learning, and people are studying this because we don't know a lot about it. But your point's well taken. We need to understand it better and continue to look for ways for clinicians to be able to give clinical care. When I was in practice, I wanted to spend as much time as I could with every person who was a patient or a resident that I worked with. So, one more idea. Somebody, what else could we do right now?
So I don't understand why these hospitals haven't expanded and done better care. There's people lined up in front of the nursing stations, out the doors, in the hallways. Evidently, it hasn't changed. I had the same experience that I had when I brought my mother to the ER. So that seems to be a big problem, every hospital I've seen.
So she was talking about the issue of emergency rooms being very crowded or overcrowded and the challenges to receiving care there. That is an issue that is discussed a lot. There's a lot of factors that go into that. In some cases, the emergency department has, evaluated someone, but there's no place to send them that's safe for them. For example, maybe there aren't any empty beds in nursing and rehab, or there's no home care services that are available to go in. Some people have had that experience, right, where, you know, someone's ready to go home, but there's no therapist or nurse or the people that they would need to come in and care for them. So that's one issue. The other thing is, as we said earlier, staffing challenges. So maybe there's not enough people working in a particular ER to be able to move people through. And that isn't only nurses and doctors. That could be ancillary staff, you know, people who work in the lab, people who are clerks, things like that. Those people actually are really important in a well-run organization. So I think you're looking at something that's been a problem for a long time, and in some ways it's getting worse with, you know, again, these recent challenges and with things like the pandemic. I mean, more people with COVID, with RSV, with other, viruses and illnesses going to the emergency room because there may not be enough primary care providers. People aren't able to get in to see a primary care provider. So so that would be a big issue to take on, and a really valuable and important one, I think. So that's good. Okay, go for it.
Be very careful to resist the temptation of letting artificial intelligence call the shots, and especially letting artificial intelligence fill in the notes that the doctors have to make after they see us, because there are mistakes and maybe nobody will catch them.
So thank you for raising that. So for folks in the room who may not know, there are electronic health records and other systems, some of which use artificial intelligence or, have an automatic, the previous visit automatically goes to the next visit, and then you have to change whatever is different on that visit. So that's potentially, if you don't have time to review it carefully, that can lead to, as you said, errors. So we do have to be really mindful of that. I chair the Moving Forward Coalition, and we had a group specifically looking at information technology in nursing homes, and those kinds of issues came up, and they still come up. We get approached all the time, and so does UMass Memorial, and so does St. V's and others, with people who have companies where they're designing these AI systems, artificial intelligence systems. There's a lot we need to learn to understand them better, and there is risk there. There's also potential benefit there, but there's risk for sure. Everybody good? Okay, we'll do some. Okay, we'll come back to the audience, but we're almost done with our slides. So I think we've made this point today, but you guys are all saying such important things. Clearly, you're knowledgeable, you're well-read, you're thinking about this stuff, and it affects each of us. So I think it really is important that your voice continues to come through. So what is important for all of us to continue to do this, to be advocates, to be champions for age-friendly health systems and age-friendly communities? What's it going to take? We feel like this sometimes, and it's fair because it's a big challenge that we face. We face all of these different challenges. There's limited resources, there's sustainability issues, there's a sign in the distance about how far the nearest gas station is. We feel like this sometimes, but we can still do this. We just have to break it down into the component parts and figure out what to do first, and then act on that, and then we can go from there, but we can sequence it to make it work. So, you got this. You're doing this in Worcester. You've got fantastic support from your wonderful team here, Amy, Suki, Jim, and everybody else who supports everything going on at the Senior Center and in the community. And again, you're already started. So remember when you got the Etch-a-Sketch when you were a kid, and you got it out of the package, and you looked at it, and you were like, what the heck is this? I don't know how to make this work. Okay, so we didn't know when we started, but we can make it work, and you're doing it. So here's our contact information. You can reach out to us anytime. We love talking with you all. Your ideas matter to us. It changes how we do things. And we have time for questions before lunch, so I guess we'll leave up our slides. Joanne.
bring age-friendly healthcare systems to our PCPs or to the docs that we go to? How can we facilitate this process? Oh, thanks, Alice. Yeah. Okay, first of all, I've brought this up at numerous meetings. I am the AARP age-friendly volunteer for Worcester. Worcester is an age-friendly and dementia-friendly city, and one of the domains for age-friendly is healthcare. And when I heard Terry Fulmer talk about this, I was absolutely positively hooked on this, because what I've seen, and my background is nursing, is that a lot of the docs no longer listen to us. And I want to be listened to. Let me just say, with my background, I am included as part of the team. I make sure I am, but I want to be involved in decisions regarding my health care and what matters to me, and also as you get older, the type of medications that you're on are really, really important, and you can't take all of them. And with age-friendly healthcare systems, there's a screen, the beer criteria. No, and it's not a rating the beer that you're drinking. It's a screen. Okay. Mobility. Okay, I'm walking with a walker. Okay, I can still get out and do what matters to me, but I need a walker. So mobility is really important, and I think as we get older, mobility becomes even more important. We have to move. We have to increase our muscle strength. We can't let our muscles atrophy or get weak. Mentation. I have a friend right now that's going through mild cognitive impairment. We have to know, we have to be aware of our diet and, everything else for that. So we also have a responsibility in our care. The other thing that I was going to ask about, I would like to see more geriatricians, because they're aware of the type of care that we need. When I looked into this, we had about 6,000 to 7,000 geriatricians and 26,000 to 27,000 pediatricians. Okay, by 2034, the population in the United States is going to be 77 million older adults and 76.5 million children. That will be the first time in U.S. history that older adults will outnumber children. It's time for our healthcare system to change. Also, Marty Meehan made the UMass college system was the first system in the world to be declared age-friendly. So I would like to see more grants for geriatricians, nurse practitioners who are going to go into geriatrics. The potential is out there.
You didn't need me and Kellyanne to come today, did you? You just contact this woman right here. You can tell she's got the passion, and a lot of you do. So again, I would take Joanne's question and say, what would it take for you, for the next time you go and see your primary care provider, or the next time you find yourself in the emergency room or in a hospital, to think about the 4 M's and to ask about them. Ask about your medications. Ask about how you're feeling. Are you lonely? Are you isolated? Are you, whatever. Ask about your mobility and what you can do and how you can act on those things. And ask about the things that matter most to you. Think about it. What would it take? Why wouldn't you do it? There's no risk, right? But you'll get somebody's attention to pay attention to the things you care about.
So I'm going to put the elephant in the middle of the room. What is the healthcare system doing to recruit practitioners, to recruit PLNs, to recruit all these people? What's going on? Are there grants? That's right, offered. What are the universities doing? I know that QCC has a nursing program. Worcester State University has a nursing. Are we getting to the high schoolers? Are we getting to the college campuses? Are we allowing, how we used to have the red stripers? Mm-hmm. Do we still have red stripers? What are we doing to put the voice out there? How are we attracting those students, or should I say children in our case, that would like to go into healthcare, but do not have the means? I'm not saying making it for free, but what are we doing to recruit our young folk into the professions?
What a great question. We did not plant that question, but we could have. I'll start and Kellyanne can jump in. So my first answer is not enough, but there are some grant programs. For example, recently CMS, which is the Center for Medicare and Medicaid Services, recently they dedicated something like $75 million for recruiting nurses to go into long-term care, nursing home work, and to become inspectors. So there's a bunch of nurses who act as inspectors. They go into hospitals and nursing homes and they look at all the regulations and is quality being delivered or not. When I was in the Division of Aging here, we worked with the Department of Education and the Department of Labor, and that's one of the challenges that we face is, you know, the people in the Department of Labor think that they're the jobs people, and the people in education think they're the education people, and of course those things are both true. And but there has to be, you know, connection across these agencies at the state level, right? They have to talk to one another and come up with ideas together and maybe come up with funding together. You know, the state budget is a huge budget, but it gets divided up into different ways. So again, the Department of Labor has these workforce investment boards. They're boards that are in different regions of the state. And they go out and do some of the recruitment of people to help people know about these jobs, know about jobs in healthcare, know about jobs in aging services, things like that. You know, not all the workforce investment boards promote these jobs, but if you talk to them and explain that they're good jobs and big opportunities for people, they can start to do more recruitment. So I think you're onto something really important, and I would say, again, you guys, your voice is important. How can you write a letter? How can you make a phone call to a state legislator, a state senator? Senator Pat Jalen of Cambridge and Somerville has been a real proponent for a long time. Denise Garlick was a proponent for a long time, Senator Garlick. So anyway, just some ideas. But Kellyanne, what else would you add?
Just briefly, that the way you asked the question was perfect, because it's not just about inviting people into the profession. We have to go upstream and address what are the barriers to doing so, the cost of education and other issues. So it's critical. We can't go forward in doing this work without an effective workforce.
Could I add some things, because I'm involved with Age Friendly? First of all, UMass Chan has a yearly nursing fair to recruit people who are interested in nursing. There have been grants. Mental health has become a huge issue. The medical school was given a $1.2 million grant to have nurse practitioners in mental health. Also, Quincy College, if you're 65 or older and you don't have a degree, I'm sorry, I haven't looked at this for a while, they have an associate degree program in nursing for older adults that want to go into nursing. So the community it's getting there. I'd just like to see more geriatricians versus pediatricians involved, and I haven't heard of any grants for that.
And I'll just echo what you said before about Marty Meehan. And, you know, again, you've got the big five UMass state universities and colleges. You know, that's a big opportunity. Why not get those people together? All right, I've got a challenge now. Okay.
Alice, first, somebody asked me on the side a question. I'll come over here. And it was, how do we know if this work is being successful? How are we measuring success? And I loved that question because I think about it every morning. So there are many levels of that. One is the work that we do with health systems in ensuring that they have ways in place to understand whether or not their efforts are successful. One is, very simply, are you going out on the floor and asking older adults how things are going? That's real data. We call it qualitative data. And our health systems can use that to make improvements. Another is we have a process that we invite health systems to go through called a process walkthrough, where we ask the team that is putting age-friendly into practice to walk through what the experience is like for an older adult coming into their health system. So what happens when you walk in the door? What is reception saying to you? Can you shadow somebody going through that process? Then, can you collect data over time to see whether there are improvements? So healthcare has very imperfect, but does have different metrics for measuring things like how are their patients reporting that they received care. There's a measure of, did your doctor or nurse listen to you? So some of the health systems we've worked with have seen, as they've implemented asking what matters regularly, those measures going up over time on the units where they started asking what matters versus the ones where they hadn't implemented it yet. So there's a measurement that we work with individual sites to look at. They'll look at other things like length of stay, and they're finding that if you are asking somebody what matters, you're getting to the critical issues faster, and so length of stay is shorter. People don't need to spend as much, they can spend as much time as they need to, but they might need to spend less time and can get back into the community, into their homes, if you've had a conversation to focus care on what matters. If you've assessed for medication and realized that they're on a harmful medication. So they're looking at what is the experience of the people, what is the experience to the health system, and then we as an organization look across all of the organizations we work with to see, are our mechanisms effective in engaging more health systems? So are we seeing an increase in hospitals that are putting really detailed plans in place for how they are going to provide age-friendly care to older adults? Are they seeing increases in the number of older adults looking at their data who receive care that includes all 4 domains of evidence-based care? And it can be really hard. Some of them stay at 30% for a long time, and we have to say, what can you learn from that? What are the components of age-friendly care that you are not seeing the level that is appropriate? And can you look at it through an equity lens? So are there certain people who are receiving age-friendly care and others who are not? That needs to be addressed.
Great explanation, and I'll just add one more thing, which is we talked about UMass and we talked about St. V's as systems. The Veterans Administration, the VA system, I don't know if we have some veterans here, Kellyanne talks with them every month at the national level, and they've done a tremendous amount of implementation with age-friendly throughout all of their community living centers and other parts of the VA. So just wanted to add that. What else? Oh, over here.
I just wondered if you have aging at home in place. Is there a component to this that would be helpful for those people that want to stay home? It's hard to find a contractor, and I've been with AARP to try to see if I can find an honest, direct contractor that would have ideas about, you can go to those bath places that will do it quickly, but you want it done well so that it, So anyway, I'm wondering about place at home.
Manage in your home.
Yes. Great. So the question is about home health, home care, because more and more we want to set people up to age in their homes, and we're recommended a particular service, so that's helpful. And I'll name for the age-friendly health systems work that Alice and I are doing. That area of work is critical, and it is admittedly newer to us. So we have been working over the past year to pilot test the age-friendly care within home health. So working with 6 agencies to really understand, what does age-friendly care look like in the home. Something about IHI's method is that we never go to the whole world and say this is how you do it without learning with a few first, because we have to get feedback from from the older adults and people who are receiving care on what the impact actually is.
And in addition to AARP, which is a great resource always, there's resources at the state that, again, within the Division of Aging or the Division of Medicaid, for some people who are on Medicaid or close to Medicaid, there's waiver programs and other things. Again, just to learn about what's available in your community, because it does vary city by city, town by town. I imagine most people here are Worcester-based, but it can vary in terms of what's available. So I know we're wrapping up. We're getting close to time. Do we have, yes?
Is spirituality. Comes beyond medications, comes beyond anything. The power of prayer is much, much stronger than anything you can take. And for people to work with each other and help each other is the way we were taught. So it doesn't really matter what your denomination is. Lean on spirituality to carry you.
Lean on spirituality. It gets back to it. It relates to the picture of the servers, the waitresses, right? In your community, who do you go to? Faith-based providers, faith-based communities. We can build from that. And again, it's what matters to you, what matters to each person here. So maybe one more comment. Echo. Okay.
A great experience is going to Salvation Army on Main Street and go to Sally's and stay there 15 minutes. A book can't write it. Amen.
Okay. There you go. Everybody's got a next step. All right. Amy, do you want to wrap us up here or say what will come next?
I think everybody here knows what will come next. A big round of applause for our speakers and the work they're doing. And we'll all enjoy some lunch.